welcome you all on our this BLS webinar. Today is our second session, and we are really grateful and thankful to Professor Dr. Mariam Mortar and her team who has organized this wonderful webinar, and we can join them even from Pakistan, from America, from UK, anywhere where we are sitting. And we are grateful and thankful to that. Before starting, I would like to introduce, as you all know, our speaker, Professor Dr. Marie Martin. She is Professor of Medicine, Cardiology, Lead Cardiologist of APNA, and past President of APCNA. Today, our panelists, we have a wonderful, young, energetic, budding cardiologist, Dr. Sahar and Dr. Nazneen from University of Las Vegas. And our another panelist, Dr. Sadia Ashraf. Most of the people nationally, internationally know her. She's intervention pulmonologist and head of the pulmonology and critical care department in Khyber Medical College, Khyber Teaching Hospital. I'm Dr. Amber Ashraf. Welcome you all, and our facilitators here, Dr. Waleed and Dr. Sadiq, who are looking after these things very nicely. And we highly appreciate all this effort. The one very important thing for the participants is it's mandatory for them to at least have 85% of the attendance in all these 4 sessions. Otherwise, they are unable to get their certificates. And those who are interested to have the hands-on session, they can outreach their departments or wherever they are, so that the different facilitators can organize these things. And inshallah, we are going to organize that even in Peshawar for those who can come, and we look after their hands-on skills and testing. I'm not going to take much of the time and hand it over to Professor Dr. Mariam Morton. Ma'am, hand it over to you.
Thank you, Dr. Ashraf, for the kind introduction. I must thank all of you for attending and for the panelists to join us and help us out. This is not a single person's effort. It is the effort of the whole group, not just one person. I'm only the speaker on behalf of everyone. Today is our day 2 of simplified version of BLS for Pakistan, and we'll be emphasizing on CPR for infant and child. We'll talk about the respiratory arrest, choking in infant, child, and adult. This is today's outline. First, we'll be talking about the infant choking and respiratory arrest. We'll talk about infant CPR and chest compression method. We will also discuss unconscious child, how they are found and what are the basic steps of revival. We'll talk about child's respiratory arrest. We'll talk about choking in 1-year-old person to that an adult. We'll talk about some special circumstances in choking. And the question was raised in the last seminar about pregnant women CPR, so we'll discuss that briefly. Depending on the time available, we'll recap with multiple choice questions that were given out to you, and we'll try and go over those answers as fast as we can so that you have the answers as well. Before you go into your resuscitation skill class, some of you are having it today as soon as this webinar is over, so I just want to give you a heads up and make sure that you do it right. So as far as the infant is concerned, infant is somebody that's between the ages of 0 to 1 year. And the usual example that we every day find is seeing a young baby who's crawling on the floor, and when he suddenly starts coughing and gagging. And what do? We always tend to panic. And that's not really the right thing to do, as we all know. We need to observe the child, make sure that it doesn't do anything wrong, and do what is right for the kid at that moment. The usual thing that I face and see is, we are praying, we have this little baby in our hand, we keep them by the side, and we have a tasbih in front of us. Next thing you know is that the kid, during the prayer, he rolls over, what he thinks is a toy, he picks up the tasbih and goes ahead and puts it in his mouth. Of course, he plays with it, but sometimes it can break. And the problem is these beads while they can go anywhere on the floor, they can also be stuck in his mouth. That's when we need to be worried about the kid. We need to make sure the symptoms don't worsen. At this time, we need to take action. More often than not, the baby will cough out, or he may hold it in his mouth. When they hold it in his mouth, don't try to push it in, because, when you do that, the baby will try and swallow it and cause more problem. Baby will turn blue, make incomplete efforts to take out the object, and that's when you need to assist them with back blows. If the baby becomes unconscious, that's when you need to yell as loudly as you can. Because when the baby is unconscious, there's not much you can do except do the usual BLS and make sure you get the baby back to breathing. You can call 911 in US, or you call 1122 in Pakistan. Usually we recommend that you start with the back blows and alternate with the chest compression. For the back blow, this is how you hold the baby as shown in the picture over here on the right side. For an infant CPR 0 to 1 year, you can have two kinds of a problem when you're doing your in-service exam. You can have somebody, they may show you an infant which is unconscious and it has been unwitnessed. And if they say the baby is unconscious and unwitnessed, you have to make sure the scene is safe for you. Don't let them show you somebody that's surrounded by a lot of grandmas and, grandparents that are around the baby and they're all trying to do their little thing. You need to make sure it's safe for you to go in, ask the permission, lightly tap for response for the baby. Look for normal breathing, but never ever shake the baby. That's very important. And if the baby does not give any response, you need to put the baby supine on a hard, flat surface. Look for circulation and breathing. Feel for either the brachial or femoral pulse, less than 10 seconds, while you are watching the breathing, if they're breathing, yes or no. Now, if suddenly you find yourself alone, you need to do 2 minutes of CPR before you call EMS. You may text or call on cell phone if one is available. But if the baby collapses in front of you, you can call EMS first to bring the AD, then start the CPR. However, if you in a place where there are more than one person, when they say another person has walked in and is trying to help you in your BLS class, when they say that, you have the other person call EMS to bring the AED while you start the CPR, because you saw the person first. It's your job to start the CPR. The second person that walks in is the one that is there to assist you. So before breaths and chest compression, it's important always to look inside the baby's mouth before giving the rescue breath. If you find any kind of visible obstruction, baby may have just vomited, may have some mucus in the mouth, or may have a foreign object, like we said, a bead from the tasbih that may be in the baby's mouth. If it's there, you need to take it out. Baby choke on small objects and the secretion needs to be cleared out, but don't push it hard. See it, if you can take it out easily, you need to take it out. Open the airway. Use your head tilt chin lift method, or just a neutral position for the infant under 1 year. You don't need to do a full head tilt. Just a little bit of a tilt is fine. Look inside the mouth, and if you see a visible object, try to remove it gently, only if you can see it clearly and can grasp it easily. Otherwise, it'll go deep inside the baby's throat. Don't perform a blind sweep. I noticed that sometimes, people try to do a blind sweep, especially in an infant. It will only push the object deeper, and it will make it harder for other people, the EMS, to come in and try to take the object out. If the airway appears clear, you need to give 2 gentle rescue breaths. Gentle rescue breath is all that's required at that time. So if they give you somebody with a scenario, pulse is present, then you don't need to do chest compression. But if they say that the baby is not breathing or is gasping, you do your head tilt chin lift. You need to look inside. You may have a barrier device. They may give you a barrier device to use, or if not, you just to make a seal over the mouth and nose and go and give a small rescue breath for a second. It's very, very important to look for the chest to rise. Allow time for the air to be expelled before you give the next breath. But it's very important in an infant to give rescue breath 20 to 30 breaths per minute. That means you're giving one breath every 2 to 3 seconds. You give breath for 1 second, 1 second for the air to come out, you give another breath. It's very important to continue doing that. And important thing is to check the pulse every 2 minutes. Sometimes I noticed that during the BLS exam, the kids, they forget to check the pulse after 2 minutes. Every 2 minutes, you're expected to check the pulse, because if the pulse is lost, you need to go into full CPR. So during normal CPR, generally you do your 30 to 2. But if the baby has an advanced airway, if you're at an institution where the baby is already intubated, the breath has to be given 20 to 30 breaths per minute. but you do not need to stop the chest compression for rescue breathing in that instance. Otherwise, it's 30 to 2. Otherwise, you just go ahead and give them the breath with the ventilator while you're doing the compression. So to recap, if the pulse is present, briefly look inside the mouth before giving rescue breaths. Visible obstruction like vomit, mucus, or foreign object, remove it. Give 20 to 30 breaths per minute and recheck the pulse every 3 minutes. These are the key requirements for a baby when the pulse is present, and you need to look into the breathing. If there is no pulse, you need to start your CPR cycles. That means for approximately 2 minutes, you do the chest compression first, 100 to 120 compression per minute at the ratio of 30 to 2, 2 breaths, 30 compression, 2 breaths, 30 compression. You always start with the compression first. And it's very, very important to remember the number of compression, whether you have an infant, if you have a child, if you have an adult, it's always 100 to 120 compression per minute. So if you're giving 2 breaths, you know that you have to move a little faster than 1 compression per second. It has to be almost like 2 compression per second is what you need to give. The compressions are done with 2 fingers. If you're using a 2-finger method, at least 1 finger breadth below the nipple line, as shown in this mannequin here on the right side. And the compression has to be at least 1.5 inch or 1/3 depth of the infant chest. You need to press hard and fast. And very important to allow full chest recoil. If you're using a mannequin that's recording your activity, if you don't do a full chest recoil, it will fail you. If you have a mannequin that does not have this recording in there, then people may not notice it, but it's very important in order to make the circulation be right, you allow for full chest recoil. Allow minimal interruptions during the chest compression. That's important. For rescue breathing, baby's face is small, so you need to cover the baby's nose and mouth with your mouth and give each breath gently over 1 second, just enough to see the chest rise. Remember, you're trying to avoid overventilation, mainly because the baby's lungs are small. They're not as big as ours, and therefore the amount of air that they need is very little. So just as soon as you see the chest rise, you know you give them enough of a breath. Now, as far as the chest compression are concerned, you can either use 2 fingers or 2 thumbs, or 2 thumb with hand encircling method, as shown here in the 2 mannequins over here. But both the thumbs has to be about a finger's breadth below the nipple line. So to recap, CPR for infant is somebody that is from birth till 12 months. You need to check for responsiveness, never shake an infant as it may cause brain damage. Tap the sole of the baby's feet and call out loud to the infant. The infant may know, if you know the baby's name, call them out by the name. If you call them out by the name, they're awake, they will open their eyes. Check the pulse, brachial or femoral, depending on what you're comfortable with. Brachial is underneath the armpit, near the armpit, and femoral is near the groin. Depth of compression has to be 1/3 the depth of the chest or 1.5 inch. And the compression delivery technique can be either 2-finger technique, as was shown earlier, you do the thumb encircling hand technique. I seem to like the 2-thumb encircling technique because that way I know how much of pressure I'm giving, but everybody is different. Whichever way you're comfortable, you use that. The rate of compression, as I mentioned, has to be 100 and 120 compression per minute. That means 2 compression per second. How fast you have to go. Just think about it. Compression to ventilation ratio in infant, when you have 1 rescuer, it's going to be 30 to 2. But if you have a 2 rescuer and knows how to give the breath, it becomes 15 to 2. That choice may be available for you in the exam, but not necessarily everywhere. Now, it's important that you call EMS. You should know that the infants tend to have more respiratory arrest and the adults tend to have more circulatory arrest. If you have an unwitnessed arrest, then it's very important that you need to call the EMS and getting the AED after you've given them CPR. But if it's a witness arrest, you call the EMS first to get an AED before the CPR. Witness arrest tells you that the heart circulation may have just stopped. It's giving you a little bit of time. Whereas unwitnessed arrest tells you do not know how long the baby has been without pulse or without any kind of respiration. So recap for infant again. Criteria for high quality CPR, weight is at least 100 to 120 beats compressions per minute. Compression depth to be at least 1/3 depth of the chest. Allow full chest recoil between compression, minimal interruption during chest compression, and do not overventilate. You need to give one breath once every 2 to 3 seconds if there is a pulse, and you add compression. Also, when the pulse rate is less than 60 per minute, especially when there's poor perfusion despite adequate oxygenation in an infant, because their pulse rate is much higher and they need more oxygenation than most of us. You need to assess pulse every 2 minutes. Sometimes, people are so good at giving the breath that they forget that they have to check the pulse. And if AED is available, you need to look for a shockable rhythm and see if it's necessary or if it's advised. It's very important to use the pediatric paddles if they're available. If not, you can use the adult paddles as long as they're not touching each other. You can put them 2 on 2 sides, or you can put them anterior posterior, which way you like. Okay. For a child unconscious, a child is one that is between the year 1 year to puberty. And if you see a child that's unconscious, you're expected to shout and tap the baby child and ask them if they're okay. Are you okay? If they're okay, they'll wake up, or they may be sleeping, not in a case when the person is passed out. They will have no response, or they may have some trouble breathing and are going in and out of consciousness. If you see that, it's very, very important that you help the person out. They may have some signs like they may have clammy skin, they may have rapid breathing, or a gray or blue tint to their lips or fingernails. It's important to call for help and begin your basic life support. Check for pulse and breathing, and you need to act appropriately. See if the pulse is present, then you have to give only breathing. If the pulse is absent, then you have to do your full CPR. Common scenario that we face, we try not to deal with it, but at one party I had this problem, so I made it into a classroom activity. Kids, they play this, what they call as a choking game. I have no idea where they learned this choking game. They try to choke each other till the other person becomes blue or raises his hand and says, I give up. So the common scenario that you may face, you're going into an empty classroom, find 2 kids, 10 to 12 years of age. One is unconscious, appears blue, and has labored, gasping, breathing. And the other kid is saying, he collapsed, I didn't do anything. We were playing just a choking game. So in that case, you need to send that particular kid to call for help. And you can call 911 or call 1122 and feel for the carotid pulse. If there's no pulse, you need to start CPR, beginning with chest compression. Depending on the size of the baby child, you may use 1 hand or 2 hands, but use the lower half of the breastbone to give you chest compression. Here in the mannequin, you can see 1 hand is being used in this child. So in an unconscious child, the basic steps are feel the pulse, look for breathing. You can use the carotid, brachial, or femoral. More often than not, we are feeding just the carotid. Some people like to use the brachial, some people like to use the femoral. It's the same circulation going everywhere, and these are the main arteries that are going back to the heart. Whichever artery you're comfortable with, you feel that one. No pulse, you start your CPRs. The ratio is 15 to 2 for rescuers, 2 rescuers, and 30 to 2, 1 rescuers. In a small child, like I said, you can use only 1 hand. In a big kid, it's very important to lock your elbow and press down, and you may need to use both your hands. 2 inches or 1/3 way down of the chest, that's what you need. And you need to do your CPR for at least 2 minutes and call for help if alone. If the pulse is present, but the person is not breathing, it's a little bit of better situation. You can do rescue breathing and do your head tilt, chin lift, and cover the mouth and pinch the nose, depending on the size of the kid. So giving breath to the child, you need to be aware that sometimes the chest may not rise with the first breath. If it doesn't, that means your airway is not open as you would like to see. You need to adjust the airway. Sometimes you may have overextended it or underextended it. Do your head tilt, chin lift. Just a little tilt from a flat portion down to an overextended portion will help in a child. Give enough of a breath to make the chest rise and cover both mouth and nose while giving the breath in a young child. If you are unable to cover both mouth and nose, you need to pinch the nose of the baby, of the child, and breathe into the mouth. Do not forget to check pulse every 2 minutes, and do it till help arise or the child starts breathing. So respiratory arrest management in general, response to respiratory arrest follows the same process as any other resuscitation, whether you're doing BLS or whether you're doing ACLS sequence. The BLS survey requires you to have safety, look at the scenario, and look at the location. You look for responsiveness and then activate the EMS. If the person is not responsive, learn to activate the EMS first, check circulation, and do defibrillation. The question that were asked in the last session that we did not answer, pediatric AEDs deliver lower energy levels, around 50 joules, but you can use the adult one if the baby one is not available. AED in the adults usually deliver between 100 to 120 joules, a biphasic shock, which are safe and more effective in the adult. So you need to be aware that there is a difference in the amount of energy that you give in the pediatric versus the adult, but if one's not available, you can use the other one. Questions for respiratory arrest. That was one of the questions that was raised, and there are plenty. Things that we find more commonly is when you have somebody who is a near drowning case, somebody who is in the swimming pool, left unwashed and is nearly drowning or submerged in the water for a long time near the ocean front or something. They have respiratory arrest because the water gets into the throat and causes respiratory arrest. You find respiratory arrest in people that had a stroke. Foreign body airway obstruction is common. In kids, it's the small objects that go inside. In adults, it's usually the dentures in the elderly that causes the foreign body obstruction. And sometimes, you can have a big piece of meat that they've taken, and it got stuck in there. So it's important that you go by person's age and see what kind of respiratory arrest they're having and why they're having it. Of course, you can have people with smoke inhalation. There was a fire and there will be smoke inhalation, and a person may have respiratory arrest, and you need to help them out at that time. Infection, epiglottitis, inflammation of the glottis may do it. And then there are cases of drug overdose that can also cause respiratory arrest. So you need to know a person's history also a little bit when you're dealing with respiratory arrest. Of course, at that time, you need to make the person breathe, but somebody can look it up and tell them if there has been a drug overdose and if you need to treat it. Electrocution can also cause respiratory arrest. Same thing about injuries. Heart attacks, yes, respiratory arrest follows after a heart attack. Lightning, if there's a strike, lightning strikes, then also a person can have respiratory arrest. And of course, if you have a coma from any cause, that can cause respiratory arrest. So as far as breathing is concerned, always look in an adult or young if the person is breathing adequately. If the person is breathing adequately, you need to put them in a recovery position. Recovery position is you put them on the side so that all the secretion fall off to the side and that they don't run into trouble. If the person is not breathing, but pulse is present, you need to put the victim or the person that is not doing well in a supine position on a firm, flat surface. And you as a rescuer has to be on a patient size position to perform both the rescue breathing and the chest compression, because you do not know what you will need at what time. At first, you're just dealing with rescue breathing, but if he loses a pulse, then you can start the chest compression right away. Learn to open the airway in an unresponsive person. Remember, the muscle tone is decreased when a person becomes unconscious. That means all the muscles become weaker and they don't have tone. Same thing happens to the tongue and the epiglottis. Both of them can fall back and obstruct the pharynx. So that's why we do the head tilt, chin lift, or jaw thrust maneuver. Both of them tries to lift up the epiglottis and the tongue, base of the tongue from the back of the oropharynx so the person starts breathing. And sometimes just doing that much may be enough to make the person breathe. If not, you check for pulse and breathing. Learn to look, listen, and feel at the same time. You're looking for the chest to rise. You're listening for the breath sounds, if they're coming, and you're feeling the air coming into your ear or not. You can provide rescue breathing by a number of different methods. Either you do mouth-to-mouth breathing, or you do mouth-to-nose breathing, or you do mouth-to-stoma breathing. It means somebody that had a tracheostomy, and you want to breathe back into the tracheostomy. Methods for rescue breathing also can vary depending on the institution where you are or whether you're out on the street. Mouth-to-barrier device can be used for breathing. You can have mouth-to-face shield rescue breathing. You can have mouth-to mask rescue breathing, or you can have a bag mask valve device that can help you with the breathing. And most of the institutions have bag mask devices to be used in US. For the adult respiratory support, you need to know if the person needs only the respiratory support, you need to one breath every 5 to 6 seconds. One breath may take almost like 2 seconds to be going in, 2 seconds for the chest to rise again. Get ready, give you a second breath. You need to see the chest rise with each breath. If it did not rise, that breath doesn't count. So you may need to readjust the person's head, whichever way you want to, by the head tilt, chin lift, or by a jaw thrust, and go ahead and give the breath again. Remember to check the pulse every 2 minutes. Person that's not breathing can lose the pulse at any time. And once they start losing the pulse, you need to go back into CPR. The recovery position is important to be established when the breathing is established. Recovery position means that you're putting the person onto the side, and so that they don't collect the secretion. And one of the methods that is being practiced in BLS at most of the places is by you kneeling beside the person who has fainted and ensure that they're lying face up. And once they start breathing, you extend the arm nearest to you at right angle, as shown over here, and with the palm facing up, and fold the other arm so the back of the hand rests on the cheek that's closest to you. Bend the knee that's furthest from you at a right angle of the person that has fainted. Carefully roll them over to their side by pulling onto the bent knee, as shown in the picture over here, and ensure that the bent arm supports their head and their extended arm prevents them from rolling further. Tilt their head slightly backward so that the airway stays open and they continue with the breathing. As far as choking is concerned, in the adult to 1 year, it's almost the same. They have universal sign for choking. Person that is choking has both hands wrapped around the base of the throat. When they have complete obstruction, they may look embarrassed at first while they're coughing when they have partial obstruction, because nobody wants to cough on somebody else, especially when you're going out for dinner and you had a piece of meat that's stuck in your throat, and then that's when you start coughing. So in choking, when there's complete airway obstruction, the person will not be able to speak or cry or provide any kind of sounds of respiration. They may appear to be confused, they may be weak, obtunded, or cyanotic, and that's when they need the most help. Partial airway obstruction, they'll have a stridor, or they may have a high-pitched audible sound during respiration. They may have a productive cough, or the person cannot speak. He may make sound, but he wouldn't be able to tell what they're doing. You get the person's attention, ask them if they're choking, if you see somebody that looks like choking, and assess for signs and symptoms. If there's partial airway obstruction, it's important that you don't attempt Heimlich maneuver. You encourage them to keep coughing, because coughing gives them more pressure from the esophagus and tries to get rid of all the food that may have been stuck in the upper airway. Now, if there's complete airway obstruction, it's very, very important that you call 911 or 1122. And if you are a qualified health personnel, you may attempt the Heimlich maneuver. That means you're standing directly behind the child or the adult, and you need to place both your arms around the person's waist as though you're hugging them, and make a fist with one hand and grab the fist of the opposite hand with the thumb inside, immediately above the person's navel, or the what we call as the belly button, and perform fast upward and inward diaphragmatic abdominal thrust. When you do that, you're increasing pressure from the stomach onto the esophagus and helping the obstruction to be relieved. You need to continue with abdominal thrust until the obstruction is removed, and if not, the patient will become unconscious. When the person becomes unconscious, it is important to start their CPR. You can do 30 to 2, but before attempting to do the rescue breaths during CPR, it's important. Just look at the airway, remove any visually present obstruction. And it's important not to do a blind finger sweep. Most of us have a cell phone which has a light. Look for it from inside and attempt to remove the obstruction as whatever you see inside the mouth. It may be just a piece of meat as the person fell down that came out. You just take it out, and then person will be thankful to you for the rest of his life. Foreign body airway obstruction can vary depending on whether you're trained or untrained. When you're a trained rescuer and you have an adult responsive victim, you should attempt to clear the airway using the Heimlich maneuver before activating the EMS system. But if you're an untrained rescuer, you should activate the EMS system first so the trained personnel can come in and instruct you which way to perform the CPR. They may just tell you on the phone, this is how you do it. You go around the patient, put your hand around the waist, and they will walk you through it, and they'll tell you what to do while the help is coming. In an infants don't really talk much, but when they have complete airway obstruction, they will be unable to speak or cry, but they will appear confused, weak, obtunded, or cyanotic. If the partial airway obstruction, they will make like an adult, a high-pitched stridor sound, which are audible noises. They'll have a powerful cough or may have a strong audible cry. When you hear that, it tells you that something's wrong with the baby. Do not attempt the Heimlich maneuver. Choking in the infant is important, but on the other hand, you just have to help the baby as much as you can. And if the infant becomes unconscious, you need to call EMS right away. You need to assess airway for any obstruction and manually remove it if possible. Remember, never ever use a blind finger sweep. You can do the back blows and chest compression in order to remove the obstruction. So the position for the infant, the important thing is you must be careful holding the baby. You need to hold the baby in such a way that the head is pointing downward. Generally, we recommend that you hold the infant face and body down on a forearm in the prone position. Support the chest by the palm and the head with your fingers, and keep the baby at a 30-degree angle with the head downward in a Trendelenburg position. And you need to use your thigh for support. The baby will start feeling heavier as you keep holding the baby longer. So if you have your thigh as for support, it'll be good. You do back blows, 5 rapid forceful blows using the flat of your palm on the infant's back between the scapula or hitting onto the backbone, and then go ahead and turn them over to the other side. Rotate the face upward in supine with the head upward, Trendelenburg position. All that you have to do is switch from one hand to the other hand, and the baby's face will be on the top side. Then you do your chest thrust. Place 2 fingers in the center of the infant's sternum as though you're doing CPR immediately below the nipple line. Give 5 rapid compression with thrust equal to 1/3 to 1/2 of the total depth of the chest. And it's very, very important to be as forceful as possible because you want to increase the pressure and make sure that obstruction is relieved. You need to do 5 chest compression and then turn back to the backside. And as you keep doing that, you will notice that the obstruction will be removed, or the baby may faint or will lose complete consciousness. If it happens, you need to initiate CPR. Before attempting rescue breathing during normal CPR, always assess the airway. Remove any visually present obstruction. That's very important. And do not use a blind finger sweep in an attempt to remove an obstruction. For choking an adult and child, just important thing to remember, when they have mild airway obstruction, they will still have good airway exchange. They can cough forcefully, so you need to keep encouraging them as much as they can cough in order to remove the obstruction. They may wheeze in between the cough, but encouraging coughing is the most important one. When they have complete obstruction, they will be clutching their throats with fingers and thumb, which is the universal choking sign. And then also you expected to ask them if they're choking and if they would like to help. And more often than not, they will say yes. If you have an adult or a child, the abdominal thrusts are important. Like I mentioned, you do it above the belly button, but below the xiphoid process. Use 5x5 approach. You do 5 abdominal thrusts and do 5 back blows. If the person becomes unconscious, you lay them on the floor. And when that happens, you have to start doing your CPR. However, there are times when you can assist them by having them bend onto a head of a chair and go ahead and do the back blows, especially in a person that's heavy and you really can't do the amount of pressure that you need to give. And same thing, you can do it if you're alone, you can choking, you can do the Heimlich procedure the same way for yourself. In a child, abdominal thrusts are done with the child standing. You kneel behind the kid as necessary. You use a chair or a stool or to sit down, depending on the size of the child that you're dealing with. And you continue with thrust till obstruction is removed, or the child becomes unconscious. That's very important. And if the child becomes unconscious, you lay them down and start CPR. When you're getting into CPR, you know this is the time to call for help and make sure that somebody comes and helps you. Call 911, 1122, whichever way you want. Choking relief, there's some special circumstances that people asked about. Number one, how do I do it in a pregnant or obese person? In an obese person, like I mentioned, you can use a chair, you can use the 2 hands in order to make the blow on the back. And in a pregnant woman, you have to avoid the belly and use the lower part of the sternum in order to get the relief. When you're doing CPR in a woman and you call for help, either you're using 911 or 1122, it's very important that you inform them that the patient is pregnant. It's when you do that, they are mentally ready for helping out the baby as well. You need to position the lady on her back on a firm surface, and you need to reduce the pressure on the large blood vessels by the uterus by pushing the uterus a little laterally. You can gently tilt the uterus to the left side by placing a rolled towel, a cushion under her right hip. That way it will move on to the left side. And then you do the chest compression, similar to anybody, non-pregnant adult. You use the lower half of the sternum, 100 to 120 compression per minute, with depth of about 2 inches or 5 centimeters. Rescue breathing after every 30 compression, as you do in an adult, any other adult. And defibrillation is equally important. You use it as instructed. AEDs are safe for use on pregnant women. They will not harm the baby. Prepare for emergency delivery. That's done by healthcare professional. If there's no return of spontaneous circulation, or what we call as ROSC, within 4 to 5 minutes, some professionals may need to perform an emergency C-section to improve the outcomes, both for mother and baby. And with baby greater than 24 weeks of gestation, you have got to be careful. You need to save the baby if you can. If the baby is more than 24 weeks, then the chances of survival for the baby is high if the baby can be brought out by C-section. Question about head tilt chin lift, how to do. That was one of the questions that was raised. I put in a graph about it. Place hand on victim's forehead and push it with the palm of your hand to tilt the head backward, as shown over here. And place the finger of other hand under the bony part of the lower part of the jaw near the chin. Lift the jaw to bring the chin forward. So as you lift up the chin forward, you're bringing the tongue forward. When you do that, the airway does open up. So to recap chest compression, in a child, you can use 2 fingers, or you can do hand circling motion with using the 2 thumbs. In a child, you need 1 hand if the child is small. If it's a bigger child, looks almost like an adult, you can use both the hands. And an adult, you definitely need both your hands because you need to press hard as much as you can onto the person's chest, and make sure you keep your elbow straight. If you keep your elbow straight and the shoulders right in front of the elbow, all the pressure will go straight down. You keep it at a straight angle, that will help you the most. So adult and chest compression that you need to do for your BLS, if you're given a mannequin, and if you think the mannequin is too high, don't forget to use your step stool. It is there for your use. Keep your arms straight and shoulders directly over your hand. When you do that, all the pressure from the shoulder is going straight down onto the mannequin. You can also bring the mannequin closer to you if necessary. And the important part is to keep the arm and back as straight as possible. I need to be flexed at the knees. It's the knee that is helping you to push through the compression. Okay. Compression rate, like I mentioned, it doesn't matter whether you're an adult, your child, infant, or whether you're doing a hands-only CPR. All of them, the rate for compression is 100 to 120 compression per minute. Doesn't matter how you're doing it. If I don't know the person's age, it doesn't really matter. So you do at the same rate. For adult child ventilation with face mask and amber bag, pictures are shown over here. You need to place the mask using the bridge of the nose as a guide. There should be no gap between the chin and the bottom of the mask, means that if there is a opening, all the air will leak out. You can use the EC method, using your fingers with the bag valve method. Press down firmly with the C form by your fingers, and do the head tilt chin lift with the E form by your fingers. Gently pull back to open the airway and ensure that there's a proper seal between the mask and the face. If there's no proper seal, doesn't matter how hard you squeeze the bag, all the air will come out. In an infant, ensure that the mask covers the mouth and nose. Make sure it's not touching the eyes or not overlapping the chin. And you can use your EC method, again for the infant. Firmly down the C formed by your fingers and held tilt with your fingers that are formed by your fingers. Gently pull back to open the airways into a neutral position. In a child or an infant, you don't really need to over tilt, you just need to tilt slightly. Ensure there's a proper seal between the mask and the face. And if the chest doesn't rise, you know that you've either overdone it or not done it right. Always remember, there's only a small puff of air that is needed for an infant. Usually you squeeze the bag maybe about 1/5, and that should be enough. You never need to squeeze the whole bag to complete a ventilation in a child. If you do, all the air will go in the stomach and the circulation will not be established. Some of the questions people had asked before that we did not answer. What do you do in the case of neck trauma? How to open the airway? You know, the 3 ways to open the airway. You do a head tilt chin lift, you do jaw thrust, or you do a head tilt neck lift, or you could avoid opening the airway, but you need to save the person's life. And jaw thrust is the safest in a person with a neck trauma. You don't tilt the neck, otherwise the neck trauma will worsen and the person can get paralyzed. The other question that I was asked was, what direction should be taken when rescuers arrive? You need, as the person that has started the CPA, you're responsible for the person. So it's your job to assign tasks to the other rescuers and rotate compression every 2 minutes or more frequently if needed. Of course, some people will say the person that comes in is more qualified and he wants to take over. Once you establish prior seniority, you can let the other person take over. But first line, it's your responsibility to assign tasks to the other rescuers and rotate compression every 2 minutes or more as needed. The 4 resuscitation skills that are needed for your BLS, you need the adult child compression, you need the adult child ventilation, infant compression, and infant ventilation. These, you need to pass all 4 of them to say that you have completed your BLS, whether you do it in the hospital or whether you're doing it at a training center. So to recap, chest compression in all is 100 to 120 without an airway, 30 to 2 in an adult child or infant, 15 to 2 in a child or an infant with 2 rescuers, and rescue breathing is 5 to 6 per second or 10 to 12 breaths per minute in an adult, whereas in a child or infant, it is 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute. Points to remember for you. Early initiation of CPR, risk of harm to the patient is low if the patient isn't in cardiac arrest. So don't be surprised. If you don't feel a pulse, go ahead and start the CPR. Sometimes it's difficult to determine if there's a pulse for a layperson. And same way, it could be you. You may not have felt a pulse in a lot of individuals, and it may be hard for you. But remember, risk of withholding CPR from a pulseless victim exceeds the harm from unneeded chest compression. So the guideline recommendation in education is concerned, you need to do frequent training in smaller bite-sized pieces as the way you're doing it now. You can do booster session, spaced learning approach, whichever way you like. A combination of self-instruction and instructor-led teaching with hands-on training is recommended generally. And if instructor-led training is not available, you can do your self-directed training. There is no limit to how you can do your CPR. And I hope all of you will score 100. And if you do that, you will be moving on to the next program. This is an effort by all of us, Dr. Amber Ashraf, Dr. Sadia Ashraf, Dr. Sahar Mahani, Dr. Nazneen Hushman, APCNA, Apna, hospitals in Pakistan. None of us have any conflict of interest. All that we want to do is increase bystander CPR response rate in Pakistan. We want to improve CPR performance as a whole, and we want to increase public awareness and public and medical professional education and training. This is a video that I found, and I think it's important, for you to listen. It's worth it. It takes you through the steps of BLS as it is applicable to Pakistan.
किसी की जिंदगी तुम्हें बचानी है, हमी है दिल की धड़कने जगानी है। तो मत करो फिजूल यार इंतजार, जीवन संजीवनी दो यार। किसी की जिंदगी तुम्हें बचानी है, कमी है दिल की धड़कने जगानी है। तो मत करो फिजूल यार इंतजार, जीवन संजीवनी दो यार। शख्स हो कोई किसी भी राह में, आग में या आग में तालाब में, उस जगह से उसको दूर लेना है, क्योंकि खुद को पहले महफूज रखना है। उसे जगा उसे बुलाओ एक बार, कि सांस बंद है क्या देखो मेरे यार। मदद के वास्ते पुकारो जोरदार, 108 डायल करो यार। मिलाओ दोनों हाथों की ये उंगलियां, बीच सीने के रखो हथेलियां। मिलाओ दोनों हाथों की ये उंगलियां, बीच सीने के रखो हथेलियां। दबाओ सीना जोर से बार बार, कि 1 मिनट में 100 से 120 बार, कि देखो सीना ऊपर आए हर बार। जीवन संजीवनी दो यार। दो इंच सीने को दबाना है, दोनों हाथ तुमको सीधे रखना है। 2 इंच सीने को दबाना है, दोनों हाथ तुमको सीधे रखना है। जो थक जाओ तो दूजे को बुलाना है, कि सर को पीछे जो को आगे रखना है। रखना खुद पे और खुदा पे एतबार, 30 मिनट तक यार। किसी की जिंदगी तुम्हें बचानी है, कमी है दिल की धड़कने जगानी है। तो मत करो फिजूल यार इंतजार, जीवन संजीवनी दो यार। जीवन संजीवनी दो यार। जीवन संजीवनी दो यार।
So, we will be talking briefly about the MCQs, just quickly run through some of them, and you can place your answers in the chat box. So, the role of early defibrillation is to, I know most of you know the answer, select the best answer. Restore regular breathing, restore normal ventilation, potentially eliminate abnormal rhythm, and improve oxygenation. But remember, these questions are being made and answered here so that you may do well on your Viva today and tomorrow. Some of you are taking it today, some are taking it tomorrow. The other question is, if an AED arrives at the scene while you're assisting or perform CPR, what should you do first? Press analyze, turn it on, place the pads on the victim's chest, and plug in the pads. And this is where we are seeing a lot of difference in opinion on what needs to be done. Remember, you need to turn it on first. If you turn it on, it tells you what to do next. Otherwise, you won't really know what's happening. What is the important component of CPR on the victim survival? Chest compression rate of 100 to 120 per minute, rescue ventilation, appropriate line breathing, or increased pulse check frequency. And as I can see, the numbers are changing. However, the chest compression is coming out first, and that is the right answer. After an AED shock, what should be started immediately? Mechanical ventilation, begin CPR, check pulse, and reset the AED. And that's where a lot of you are going wrong. I'm surprised. Once after the AED shock, you are expected to start the CPR all over again. Definition of a child is someone who is 28 days old, greater than 1 year, but not yet reached puberty, someone who is not ready to go to school. And all of you are giving the right answer. Greater than 1 year, but not reached puberty. For adult 1% CPR, the ratio of compression to breathing is, and as we discussed, agnosium, all of you are giving the right answer. Some are giving it wrong. Chest compression, 50 to 2 breaths, 30 to 1, 60 to 2, or 30 to 2. The ratio is always 30 to 2, and that's what you need to remember, whether you're an adult, child, or an infant. The main component to adult CPR in order are high-quality chest compression, airway breathing, and AED. And that's where some people are getting a little confused, and I can see the answers are varying. High-quality chest compression, breathing, airway, AED, which way you want to go. The important thing is to start the circulation first and look at the airway and see, make sure the person is breathing before you give a shock. So the answer is A, high-quality chest compression, airway breathing, and AED. Question 8, chest compression depth in an adult required is at least 2 inches, 4 inches, 1 inches, or 6 inches. Oh, I'm surprised. Everybody is giving me an A as an answer, so I'm happy that at least 2 inches of chest compression is being needed. Risk factors for heart attack include, we have not discussed this, but important thing to know is that, risk factors are important and that have been proven over time, smoking, high blood pressure, and high cholesterol. And most of you are giving the right answer. You don't worry about the other things. Yes, the other things are equally important, but you worry about smoking, high blood pressure, and high cholesterol. Chest compression for adults should be at the rate of, and we have talked about it 101 times. And most of you, oh, I'm surprised. A lot of people are giving me an A, which is wrong. 60 to 80 beats per minute, 80 to 100 beats per minute, 100 to 120 beats per minute, or 120 or 150. Memorize it. It's 100 to 120. Doesn't matter if you're an adult, if you're young, or you're old. You're walking down the street to catch the bus and see a person in front of you. Suddenly, while walking collapses, you find him to be unresponsive. You are the first rescuer at the scene. What is the first action to be taken? Activate the EMS, start a high-quality CPR, rescue breathing, or verify the scene is safe. And as you saw in this video also, always make sure you're safe and it's safe for the victim. If it's not safe, then it's not worth it. Heart attack symptoms include, this we have not discussed, but you need to start learning about it because we'll go into ACLS next week. Chest pain or left arm pain, coughing, crying, uncontrollable laughter. And most of you are giving me the right answer without the presentation. Great. Chest pain or left arm pain, that's important. Once pulse is recorded, you should check for breathing and check for pulse every 2 minutes. Give him some food and water. Place him in a good area where he can rest alone, or you can go about your work. And I'm surprised all of you are giving me the right answer. You should check for breathing and check the pulse every 2 minutes. Recovery position requires a patient to be laid face up, placed on the side with the face on one side, the person to be in upright position, person to be placed on a bed with the rails up. And this is where there's a little bit of confusion here then. So you need to remember, you need to place them on the side with the face on one side, not necessarily put them with the face up. For infant CPR, if pulse is present, how many breaths to give? Number of breaths that you need to give to the infant is much higher than what most of you are writing. You need to give at least 20 to 30 breaths per minute and recheck the pulse every 2 minutes. So the answer C is the correct one, not the B, as some of you are writing. For infant CPR, if pulse is present, you need to give them 20 to 30 breaths per minute and recheck the pulse every 2 minutes. Chest compression rate in an infant is, doesn't matter if you're young or old, we always worry about the chest compression rate, and the answers are, like all of you are writing A, and I'm happy with it. So this summary is making a little difference. Chest compression depth in an infant is 1 inch or 1/4 of the infant chest, 1 inch or half depth of the infant chest, 2 inches at least or half of the infant chest, or 1.5 inches at least, or 1/3 of the depth of the infant chest. And that's where a lot of people are wearing. And the answer is D, like some of you are writing now. Chest compression has to be at least 1.5 inch or 1/3 the depth of the infant's chest. If you don't go deep enough, you're not doing the compression. If the chest does not rise with breathing in an infant, what should you do? More often than not, all of you are coming back towards the right answer. You do the readjust the airway and give another breath. That's the important part, okay? You don't do a blind sweep, you don't give a baby a good shake, and you don't give a good thump on the chest. If an adult appears to be choking, you ask the person if the person needs help. Not give him a face smack if he's coughing. Don't give him some water to drink. He's already choking. And don't ignore him because he's an adult. Adults are the ones that are thick-headed, but they will ask for help as needed. So if an adult has universal sign of choking and you notice complete airway obstruction, what should you do first? This is where there's a little bit of confusion. Call 911 or do a Heimlich maneuver, do abdominal thrust, or lay him down. Some of you are giving the answer A, some are giving B and C, but it all depends on your level of expertise. Generally, we recommend that you learn how to do Heimlich maneuver, and this is the level of expertise where it makes a difference. You can do abdominal thrust, you can call 911, but if you're considered as a healthcare professional, do the Heimlich maneuver. Best position for relieving choking on an infant while doing chest thrust is Trendelenburg position. You have to keep the head down, not upright on your shoulder, not upright in your arm, not sitting in your lap, because all the obstruction will still go into the airway. So you go for the Trendelenburg position. If the infant faints while you're clearing the obstruction with abdominal and chest thrust, what would you do? You'd remember your ratio, what the ratio is. The ratio is always 30-2. And you remember that and you'll do well. In an adult choking, what should attempt to do? What do? You give them a Heimlich maneuver, or do you do the abdominal thrust? Do you do chest compression, give water, go do a blind sweep? And I see that most of you are giving the right answer, and I'm happy to see that. In case of neck trauma, how do you open the airway? Head tilt, chin left, jaw thrust, head tilt, neck left, wide opening the airway. And I see a lot of people are giving me the right answer. I'm surprised, you know. The answer is B, jaw thrust is the important one. What direction should be taken when rescues arrive? And that's what we discussed earlier. You need to assign the rescue task to other rescuers. You are the one that is in charge at that moment. So you should go ahead and do that. But sometimes, you know, people will say direct others as a team leader. However, for the exam purposes, you assign tasks to other rescuers and rotate compression every 2 minutes or more frequently if as needed. So remember one thing, ACLS training builds on basic BLS support and includes high quality CPR and use of an AED and airway management techniques. You have already done 2 parts already. You only have to do 3 parts. Recognition and management of conditions like cardiac arrest, arrhythmia, stroke, pharmacology for emergency situation, and how to be an effective member. So when you get your other 3 parts done, you will have done your ACLS as well. So we'll deal with it next week. So remember, practice makes a man perfect. Do your best. You're ready for your hands-on training experience. And please check with your organization for hands-on training and get certified. ACLS will follow next week. And we are open to question. Thank you so much for attending.
Thank you, ma'am. That was a wonderful session, and I think you have cleared all the queries and questions, and especially the MCQ session is wonderful. In the reports, I have seen few of the comments and queries for which I request Dr. Satyam to answer. One of the important things they are asking regarding the Peshawar.
You're breaking up. Dr. Ashraf, you're breaking up. Well, it seems like Dr. Ashraf is breaking up. Maybe she has a communication issue there.
Ma'am, is it okay now?
Yes, it's better. It's better now. Yes.
Am I audible? Okay.
Yes.
Okay. Hello, everyone. First of all, I must congratulate APNA and the team effort behind this very successful webinar. And thank you, Dr. Mariam, for such a wonderful session. And you have explained each and every concept in a very easy, accessible, palatable way. Thank you very much. As far as the query is concerned, we at Habit Teaching Hospital, we have a dedicated space for this BLS hands-on courses as well, and we are continuously doing these mm,
I think because of the time limit, the BLS is voice is not being heard.
we are doing these courses and some mandatory part of curriculum to get. And at the house of job level, it is of course
We have a little difficulty hearing you.
okay. Okay, I think so. There was a drop in the connection. Am I audible now?
Yes, now you're audible, please. Yes, go ahead.
Okay.
Yeah.
Okay. So not only in the undergrad, also at the resident time, there is a full mandatory requirement as PMDC, and we are conducting these courses for the house office.
There seems to be a little bit of issue with your connection. But anyway, I am very hopeful that we will be doing this webinar a little bit more often.
We did this hands only CPR and trained more than 800 people, and they are from different areas, not only the students, but also in the OPD, the general public, as well as in the PICO Institute, that is the Ophthalmology Institute, the general public, healthcare professionals, and the rest of it. So during the month of October, more than 800 people were trained with the hands-only CPR. So we are conducting and we are trying to put our drop in this genuine cause. But I think so the Apna platform is something that we would like that to propagate this, that yeah, we are providing these services, and there's a contact number, and we would request you that we'll make a flyer and all the informations be propagated on your site, at Apna site as well, because this question that in Peshawar no one is doing it, it means that there's definitely a lack at our end, that we are not using the information and propagating the information rightly. So thank you very much.
We will try. I will talk to, if you could just send us the flyer, I'll post it on the BLS webinar site, and people will know about it. Thank you so much. I really appreciate what you're doing and getting more and more people trained. That's the goal.
Thank you. I think so. That is a wonderful session. Question answers and things are
Sure. Thank you very much.
we can accommodate online. Thank you. Thank you.
Thank you so much. Thank you. So we'll meet next week.
For the next webinar, please do come prepared with the BLS so that we can looking forward for the ACLS session.
Thank you so much. Really appreciate everybody joining and willing to learn. That makes a lot of difference. Thank you again. Thank you to all the panelists.
Thank you very much.
I really appreciate